Today we are going to discuss the bird flu outbreak. The first case of bird flu was diagnosed in China in the year 1996. Going to further, the infection of bird with avian influenza type A virus is known as the bird flu, which is most common in the Asian. The most common counterpart is the H5N1, and second is the H7N9. It is most commonly found among the wild aquatic birds. Infected birds can set the avian influenza A in their saliva, nasal secretions, and feces. Reservoir host. If you talk about reservoir host, these are the animals which keep the virus in their body without being get infected. The most common ones are the gulls, ducks, geese, and swans. Avian influenza has two most common types. Like one is the low pathogenic type, that is which shows no disease or mild illness in the infected animal, and the high pathogenic, that is also called as severe disease and shows high mortality. The mortality rate is 90 to 100% in 48 hours. Avian influenza usually do not infect humans. The human infection happens when enough virus gets into a person's eye, nose, or mouth, or is inhaled. And since the virus spread from one person to another is reported very rarely, and even though when it is reported, then the cases are not very severe. This is the picture which is given by the Center of Disease Control. It shows how the humans can get avian influenza. First one is the direct contact. Direct contact is either we come into the direct contact of the saliva, feces, or other bodily secretions of the avian birds, and by touching the surface from which are contaminated with the bird feces, saliva, or other bodily secretion. Another one is in the format of droplet or dust. Like if the birds flap their wings, there is scratching of the ground and the shaking of the head by the bird. The aerosols of the virus gets into the atmosphere, which can enter in the human body through eyes, nose, or mouth. And what now we will discuss what are the signs and symptoms of the bird flu in human beings. First, the most common signs and symptoms are fever, cough, sore throat, muscle ache, abdominal pain, and vomiting. The most severe complication, that is the severe respiratory illness, which shows in the form of shortness of breath, difficulty breathing, viral pneumonia, and respiratory failure in severe cases. When neurological symptoms occur and the virus shows symptom of the brain involvement, then we had the symptom of altered sensorium and seizures. How the diagnosis can be made? For the diagnosis of the avian influenza in human beings, swabs are collected from upper respiratory tract, that are usually from the nose, nasopharynx, or throat of a sick person, and the swab is subjected to reverse transcriptase PCR test for the diagnosis of avian influenza. Now, who will be called as the exposed person? Exposed person is defined as a person with contact in past 10 days to infected, sick, or dead bird or infected flock of birds. There should be a mandatory monitoring of the exposed person for new illness for 10 days after the last known exposure. And who will be called as the infected person? Infected person refer to infection with the avian influenza A associated with severe human disease or which have the potential to cause severe human disease. What we can do if we are get exposed to the virus anyway, There are both pre and post exposure prophylaxis. The oseltamivir drug is used for pre and post exposure prophylaxis for 7 to 10 days depending on the exposure time. Since symptoms in human are very quite similar to COVID-19, at this time of COVID-19 pandemic, we should take maximum precaution to protect ourselves. Hence, we should not get co-infected